physically. Varicose veins, swelling, mood swings, backaches, heartburn, fatigue, and sleep loss. These are just a few of the side effects that pregnant women experience. Since its announcement in 2022, COVID-19 is one of the additional concerns for pregnant women. Naomi Brownbill is a staff nurse at the Joseph N. France Hospital. Today, she's here to give us insight on how pregnancy is during the pandemic. So welcome her. Hi, Miss Brownbill. How are you?
Hi, I'm fine, thank you.
All right, wonderful to have you here today. So let us know, is it safe to have a baby in the middle of a pandemic?
Yes, it's safe. You can get a baby during the pandemic.
Are there any additional concerns?
Well, the additional concerns is basically related to the COVID-19 infection, but there are preventative measures that you can utilize to help to prevent you from becoming infected during the pandemic while pregnant.
In terms of these preventative measures, Nurse Brownbill, I have to say, well, to be honest, I'll go back to the question Mimi asked you for a little bit as to whether it is safe to have a baby in the middle of the pandemic. As someone who is not in the health sector, I have to say I'm grateful that you said it's actually okay, because I was looking at the protocol, was looking at social distancing and thinking, with all of the concerns that we have concerning grown-ups and the spread of the virus, I don't know if pregnancy would perhaps be the pregnant women would be experiencing additional strain or stress concerning the protection of their babies. So to hear you say that there are precautions that they can take to ensure that their babies are safe is very reassuring. What I have to ask you now is, in terms of the prenatal and postpartum care at the hospital, has the pandemic affected your work in any way concerning that?
Okay, in relation to prenatal and postnatal care, there has been some changes we've had to make, but in relation to the care itself, there hasn't been much changes. You still receive the recommended number of prenatal visits, and you still receive the recommended postnatal visit. One of the changes that we had to make was in relation to visitation, and we also had to make change in, the usual preventative measures where you use hand sanitization, such as your hand washing with soap and water, utilization of your mask. That's one of the things that we have put in place. All pregnant women, they will have to wear a mask at all times, especially while they are in the labor and delivery room, because one of the exercises that we utilize in the labor and delivery room is deep breathing exercises. So, and we usually have to be very close to the patient. We're providing care, so we will not be able to social distance from the patient. So a mask is very important during that time. But in relation to the prenatal and postnatal care in itself, it's still the same.
Okay. So you mentioned, of course, in the delivery room, there are certain protocols in place. Are those protocols different if the mother is COVID-19 positive?
If the mother is COVID-19 positive, we have a designated delivery room for patients who are COVID-19 positive. So they would not utilize the regular delivery rooms that we have. We have a designated delivery room for those patients.
Okay, that completely makes sense.
That delivery room has all the necessary equipment that is needed for women in labor.
That's great to know.
Have there been any other changes concerning pregnant women? Because there is some information, apparently, let's call it word on the street, that there have been cases among pregnant women, and you basically confirmed that, as well as speaking to the measures that you use to ensure that the virus isn't spread in any way. I do have to ask, though, concerning pregnancy and COVID-19 positive women, have we seen cases, or are you aware of cases where the babies themselves are born inoculated against the virus, so to speak?
No, I don't know of any cases.
All right.
I think that's good to know.
Yeah.
And what about mother to child spread? How do we prevent that in the event that a mother who is giving birth has COVID-19?
Okay. For the mothers who are COVID-19 positive and give birth, we still, once the mom is stable and she's not critical meaning that she's not in any severe respiratory distress where she's unable to breathe on her own and she's having difficulty breathing. Once she's stable enough, we don't separate mommy and baby. We still encourage women, which is very important. We still encourage breastfeeding. Baby will stay with the mommy 24 hours per day. But we encourage the mommy to wear her mask at all times especially when she's caring for the baby. We encourage her and remind her about hand washing. And when we say hand washing, we don't just mean the hand sanitizers, we mean
Actually
hand
washing
with soap and water.
Yes.
So we encourage that. We encourage her to keep the area clean, including the frequently touched areas. We expect that she will keep that area clean. She wash her hands and use her mask. So she cares for the baby as normal.
And what about feeding the baby? Is
If the
there any
mommy-
chance?
If in the event that mommy is having respiratory distress and she needs critical nursing care, then the nurse will care for the baby and the mommy will be transferred to an area for critical care.
But I was asking, what about breastfeeding the baby? If the mom is COVID-19 positive, is it possible to transmit the disease via breast milk? Just curious.
No, you still encourage breastfeeding. Breast milk has the properties to help to build the baby's immune system also. So breastfeeding.
I know you guys always promote that.
Nurse Brownbill, as a nurse in your capacity, I'm sure that you receive a lot of questions from pregnant women concerning, the health of their baby, etc. In addition to what we've asked you so far, have there been additional concerns that you'd like to address, or is there anything that you'd like to say just to allay the fears of families who are expecting babies during this time?
Okay. Some persons have asked if they are COVID-19 positive, if that means that the baby is COVID-19 positive as well. And the answer to that is no. We've had some cases where the mom might be COVID-19 positive and the baby is not positive. So that's one of the questions we tend to get.
So, I'm gathering from all of this that mothers need not be particularly worried in terms of having a baby during this time. Can I say that's a fact?
Yes. No need to worry. It's
Be
like
careful.
a normal delivery.
Well, how much of that do you think is attributed to the health system in general? Because I know that in general, we've had campaigns out there, encouraging these social distance protocols and everything else. So as someone who is in that field, as someone who, even talks about the way that you implement those measures on your job, have there been challenges to implementing it? And what can you tell us about the way that you've been coping with COVID-19, even as a health worker?
Well, in the beginning, in preparation for COVID-19, it was a bit, I would say somewhat a bit of a challenge at first. COVID-19 was new. We were preparing for something that we had very little information about. But presently, I would say that we are prepared for any mother who presents with COVID-19.
Well, that's good to know.
Yes, I am sure that's very comforting to all mothers and expecting mothers around this time.